So really what I'm going to be talking about today, while we use liposome technology, that's really the tool to help supplement difficult to absorb molecules, right? So the liposomes themselves are just a means to an end, right? And what I want to talk about is, I want to talk about vitamin C and how to truly understand how to properly supplement it, and also two other molecules which aren't commonly talked about, which are glutathione and phosphatidylcholine. And later on in the presentation, I'll really get into why it is that we haven't really been discussing these two molecules much around us. So let's just start off with something really, really simple, and such as our lifespan. At one point we're born, and eventually we all pass away. Well, as it turns out, during birth, for instance, our brain is going to be comprised of almost 80% of its dry weight is going to be phosphatidylcholine. And when we die, it's going to be closer to about 25 to 30%. So it's a direct indication. So you can literally track a person's lifespan by how much phosphatidylcholine body. And phosphatidylcholine is more than just part of your brain. It's what your cell membranes are made out of. It's what your liver is made out of. It's really ubiquitous. It's throughout all of us. And it's what determines the integrity of our cells, the strength of our cells. So you can imagine if this is a straight line, perhaps there's a way to flatten the certain section out. Well, you know, we're probably here, right? We probably already haven't been supplementing with phosphatidylcholine our whole lives. And, you know, maybe we could start doing it so we keep our levels higher. And this is going to also be true for glutathione. And I'll talk about what glutathione is in a minute, right? And then we'll get here. So one way or another, you're going to get from this level to this level, but hopefully we can alter the graph to look like that. So glutathione, let's talk about what that is for a moment. Glutathione is another extremely important molecule in your body. It's most commonly found at highest concentration in your brain, in your liver, and in your eyes. It's a tripeptide, and its main function, its number one main function, is antioxidant protection. It's in fact called the master antioxidant. Without it, vitamin C doesn't work, vitamin E doesn't work. A lot of functions of your body don't work because it's the second step in making energy, making ATP. It's how your body pulls heavy metals, poisons, toxins, toxicants out of your body. So you can imagine that it's unbelievably important. And just like phosphatidylcholine, you can look at the ratio of the reduced, which is this version, versus oxidized, and you can tell a person's general health. When you're healthy, you have a lot of this version, period, and most of it is the reduced form. As soon as you get a virus, all your glutathione goes to fighting the disease, and it gets converted to this form. When you're exercising, once you start getting fatigued, once again, you start getting high on this version. So this is truly another molecule that you can track the health of your body. So the other thing I didn't say before is that every single cell in your body has it inside of it, except for some of your skeletal cells. That's it. So other than some of your bones, you have it literally in every single cell of your body. The main problem with glutathione is that your body is continuously making as much of it as possible. However, a lot of times we don't have the right ingredients and we don't have the machinery in our body to make enough of it. So what happens is that we have limited amounts in our body. And as we age, those amounts go down and go down and go down because our capacity for manufacturing it in our bodies also is diminished. Now, one of the main reasons that nobody's been talking about glutathione is because historically, if you took a pill with glutathione in it or food with glutathione in it and you ate it, your stomach would just break it apart into its three amino acids, glycine, cysteine, and glutamate. Okay? So basically, its absorption rate was well below 0.1%. Basically, it was a waste of money. However, now we have the tools to be able to supplement it, and that tool is called the liposome. And in a minute, I'll go into what that means. So the next molecule we want to talk about is vitamin C. And this is another one of those molecules that you can track a person's life with. We know that people with high levels of vitamin C are healthier and live longer than those with low levels. That's throughout the literature, that's a well-known fact. It's a powerful antioxidant. It protects your DNA. Once again, though, you need glutathione to activate vitamin C, and then it's able to protect your DNA. Then it can act as an antioxidant. Another part that people really don't talk about vitamin C very much, but it's essential for moving fat into the mitochondria, where it is used for energy. So without vitamin C, you can't put fat into your power plants in your cells to burn it up. So without vitamin C, you can't burn fat. And the other thing that's really, really important about vitamin C is it's integral in synthesizing collagen, which is, what our skin, our blood vessels, our tendons, ligaments, bones are all dependent on collagen manufacturing. Otherwise, they're just not rich, but they fall apart. So here, let's look at, this is a graph of absorption of vitamin C. So if you take more than 60 milligrams of vitamin C, most of it ends up in your urine, not in your body, right? So basically, don't worry about what these numbers mean, but basically it shows you right here that after you get to about 200 milligrams of vitamin C, it doesn't matter whether you take 500 milligrams, a gram, 2.5 grams, the amount that your body absorbs is all the same, right? So all these times when we take our 1 gram vitamin C tablet, it just all ends up in our urine. And that's what this is showing, that as you increase the dose, just to get more vitamin C in your urine, right? So the question is, if we know that vitamin C is integral, and we want to increase the amounts, how do we increase the amount, right? So this is just a little bit more information about glutathione and some of what low glutathione levels are associated with. Neurodegenerative condition, especially your brain, is the highest amount of glutathione in your body. And we already talked about how it's broken down. Now, to increase, we just talked about how, potentially how you would increase vitamin C. But if you tried to increase glutathione, traditionally, you would take precursors such as cysteine, N-acetylcysteine, and methionine. However, these are often toxic at high amounts. So you want to increase glutathione, but you don't want to increase body toxicity. So the solution to this is the molecule we were talking about earlier, which is phosphatidylcholine, right? It's part of every cell in your body. It comes from soy, sunflower, eggs. What's happened is, as people have become more concerned with cholesterol, we stopped eating eggs. But as we stopped eating eggs, we also stopped getting phosphatidylcholine, which is the white part in the egg, right? So now people aren't eating the phosphatidylcholine, and they're getting what's known as non-alcoholic fatty livers. So basically, by not eating eggs and phosphatidylcholine, we're getting alcoholic livers without the alcohol. So, basically we're getting sick without all the fun that's associated with that. So it's so good right now that pharmaceutical companies are trying to turn it into a drug. And what they're trying to do is register it as a drug just like anything else that you'd have to buy in order to supplement yourself, because they're trying to get you to have lower cholesterol so you don't eat eggs, but now they want to give you a drug to make up the difference. And the great thing about this, though, is that phosphatidylcholine is very, very well absorbed. So what we do is we take all the phosphatidylcholine, and this is its structure, and what we do is we turn it into a little cell just like this, all right? And inside of the cell, we could put the glutathione, and we could put in the vitamin C's. So basically what happens is when you ingest it, your body just sees the phosphatidylcholine, which is this part, and it absorbs it at very, very high rates. And all the stuff that's inside of there comes along for the ride. So rather than the vitamin C being rejected through your urine, it gets absorbed into your body. Rather than glutathione getting broken down by your stomach acids, it's protected by this little cell, this little liposome. It's made out of completely natural phosphatidylcholine, so it's non-hydrogenated, non-hydroxylated. It's very, very stable, and it is water-soluble. So if you pour it into water, it's going to disperse out immediately. And for many of you guys that have already used this product, what you'll see is that it has almost the same consistency, the same look, the same function as milk. And the reason is this is literally a copy of natural breast milk. This is how mothers nurture their babies, is they have vitamin C and they have different nutrition in these kind of cells in their milk, and then because babies' digestive tracts aren't capable of absorbing very much, this still works, okay, the liposomes still are able to deliver this really, really important nutrition. So let's take a look at what this stuff really looks like under a microscope. So if you were to look under a microscope, and this little bar right here is 400 nanometers. Okay, so this is really, really small. This is called scanning electron microscopy. What you can see is these tiny little bubbles. And depending on how we slice these little bubbles, some of them are going to be convex and some of them are going to be concave. But this is really cool. This is literally a picture of the liposomes under a microscope. There's other products out there on the market. However, when you look under a microscope, you see that they're just a foamy mess. There's really nothing there. It's just, it says liposome on the label, but there's nothing inside of there. Okay? So the liposomes in our products are 95% of them are between 50 and 420 nanometers. And it's independent of the payload. So whether it's the glutathione or the vitamin C, it doesn't matter. It's always going to be the same nice little tiny particle, which is similar in size to what's found in milk. I do want to point out that this is a 100% vegan product, non-dairy. Okay. So the other advantage of liposomes is that the types that we make is we use a very gentle processing method. So there's room temperature and room pressure, so we don't get any degradation of phosphatidylcholine, the glutathione, or the vitamin C. We use only natural and health-building materials. So we don't add synthetic flavoring or anything unnecessary. The label is very, very simple. When you look at the label, there's only a few ingredients. Okay, so now let's just get down to the science. And what we're seeing here is this is the first example. So this product is literally the first example of a liposome in nutritional supplements that actually works. So in this graph, what we have, and this is clinical data, so it's on a human being, and the nice thing about where our factory is we're right next to a university. So for about $50, a college kid will do almost anything. So what they let us do is give them regular powdered vitamin C and pull their blood every 45 minutes. And what you see is that you get an increase, which peaks out at about, 2.5 hours, and then it kind of comes down after about 6 hours, right? So this is 5 grams of sodium ascorbate, of ascorbate as sodium ascorbate, and this is the saturation point of your blood, right? So before that, this is the highest vitamin C level anybody could attain via an oral method. And then we did the same thing, but we gave them the liposome. So what you see is that it goes up much faster, and the difference between this and this isn't a third. It's not the difference between 2 and 3, and that's due to blood equilibrium. This is really probably something like 10x absorption of the vitamin C. What you see is it climbs faster, it gets higher, and then it stays up for longer. And for this particular individual, you get elevated vitamin C levels for 12 hours. What's really nice about this, if you take this product twice a day, you get heightened ascorbic acid levels, vitamin C levels in your body all day long. This was the previous attempt by a different company to get increased vitamin C absorption. And as you can see, the regular powdered vitamin C and the liposomes are almost identical. And both of these graphs are the same as this graph. They're just on different edges. So what's nice is here is proof that we actually can deliver vitamin C at much higher levels than was ever able to before. The other nice thing about that salt that we're talking about is that at 5 grams of sodium ascorbate, a little over half of the subjects, so it's talking about 25, 26 people, had stomach issues. They took the sodium ascorbate, they did a blood test, and halfway through, 45 minutes when they weren't getting their blood drawn, they were having stomach upsetness and what's known as osmotic diarrhea. However, with the liposomes, 0% of the subjects, and these are the same subjects, so one day they came in for the powder and the next day they came in for the liposomes. So the same people that previously had stomach issues no longer had any stomach issues with liposomal vitamin C. The other thing that we looked for was what's known as ischemia reperfusion injury. Okay, and this is a model of the kind of cardiovascular injury that you get, or heart injury that you get during a heart attack. Okay, So we did this on 16 healthy adults. Once again, these were all people from the university, some of them professors, some of them students, who were interested in finding out more about their bodies. And what we see here, this is for the placebo, okay? So they go here, they put a cuff on their arm, basically, and we cut off the circulation to their arm for 20 minutes, and we track the increase of cardiovascular damage in their arm. Obviously, we can't actually give somebody a heart attack because we don't want to kill them. So what we do is we give them an injury which they can recover from just in their arm. So you can see that basically here, their oxidative stress goes up many, many fold. Okay, this is it goes up dramatically. However, when we give them the liposomal vitamin C, we increase the oxidative stress, but the damage due to oxidative stress actually went down. So even when we were increasing the amount of oxidative stress, the cardiovascular system was actually still getting healthier and healthier because it was being protected by the vitamin C that was already in their arm. So this is quite amazing data. This is the first data of its kind showing really how powerful vitamin C can be, especially during an event such as heart attack or other kind of reperfusion injury events. So the other thing you can imagine is if you're an athlete or if you like working out or if you like to exercise. When you exercise, your oxidative stress goes to the roof because you breathe a lot and you burn a lot of oxygen. So obviously you're going to get a lot of oxidative damage. So you can imagine that if you were to take this during while you're exerting yourself in exercise, you'd be able to have better endurance and better protection for your cardiovascular system, which is really, really important, especially if you exercise regularly. The next set of data, this is with liposomal glutathione product, is we wanted to look and track glutathione levels in a person's body. However, as it turns out, there's no reliable way of measuring glutathione in the blood. I looked high and low from various different labs, and what I found out was that the numbers were not very reproducible. I would send them 5 identical blood samples, and I would get 5 very, very different results back. So we decided to look at secondary markers of glutathione, because glutathione, like what we talked about, I mentioned before, it is critical to the body's detoxification system. So if you've ever looked at blood mercury and mercury detoxification, you know from the literature that it takes about 3 months to just get the needle moving and just to get the numbers a little bit down on blood mercury. What we saw here is that within a week, people's blood mercury levels were already going down. And after a month, for many people, they were dramatically reduced. Now, this subject right here started off with no blood mercury and ended up with no blood mercury. So this guy is extremely healthy. But what we've also shown is that at least our product isn't introducing any mercury into his body, which we already know that from our lab testing. So this is really, really great data. It's showing that the glutathione is being delivered quickly in an efficacious way and reducing blood mercury levels. What we did was we then expanded it to 7 human subjects. Subject number 3 and subject number 6 both had no blood mercury to begin with, nor any at the end. But what you can see for subjects 1, 2, 4, 5, and 7 is that they started off with higher levels of mercury and ended up with much lower levels of mercury. And this was within 4 weeks. So this is only 28 days. Had we expanded this study, so let's say 3 months, these levels would have continued to go down and down. And this person started off with 1.3 and then ended up with a non-detect level for blood mercury. So this is really, really exciting, good data. But more importantly, it shows that glutathione is being delivered. So we also looked at bilirubin. So for subjects 5, 6, and 7, and bilirubin is a really, really great example of liver function. So bilirubin are basically dead blood cells, and the lower your bilirubin levels, the better your liver is functioning because it's able to kick out the dead blood cells. And what you can see here for all 3 subjects as we measured their bilirubin, in 4 weeks, their bilirubin levels improved dramatically. Something that was unexpected was that creatinine levels also went down for these subjects. And the reason we decided to look at that is because there's a lot of data showing that that you can track renal failure with glutathione. So as the renal function, as your kidney functions go down, your glutathione levels also decrease, and it's a one-to-one type of association. So we figured out, well, maybe if we increase glutathione levels, creatinine levels would go down. And that's exactly what we saw for these 3 subjects. So for glutathione, while we weren't able to measure it directly, we were able to see that the blood mercury levels went down, bilirubin levels went down, and creatinine levels went down. So I hope during this talk I showed you that structurally we have a highly controlled system where we're able to make these tiny little bubbles to go around the nutrition, that these bubbles then increase the absorption and also had a function of a little bit of time release. They protected the payload and protected your stomach from payload, right? So people weren't getting stomach upsetness when they were taking this product. For glutathione specifically, we can see that it's a delicate material, but now we have a way of avoiding the precursors because the precursors themselves can be very, very toxic. And that you increased general well-being and health in many human subjects. So that's the conclusion of my talk, and I'd be happy to open it up now for any questions or for me to clear up anything that perhaps I didn't explain clearly enough.